Hi, this is Dr. Randy Goldstein. Today I wanted to talk to you about knee pain and some of the instances where you might be able to wait to go to the doctor and see if things get better. Let's go over the anatomy quickly. The green arrow shows you the knee joint. It's how the knee straightens and bends. The red arrow is the femur, the large bone between the hip and the knee. The blue arrow is the patella, or the kneecap. The yellow area is the area where the patellar tendon is. The patellar tendon's job is to straighten the knee. And the patellar tendon is connected from the patella to the tibia, the larger of the two bones at the lower leg. The blue arrow is showing you the apophysis, or a growth plate area that the patellar tendon connects to. In growing kids, this is open. Once you're an adult, it closes. At this time, as a child, the area is not as strong as the rest of the bone, and an area that could get injured. So injuries happen because of sport, possibly traumatic, or maybe overuse. And they can happen not during sport as well, like a growing injury or even an illness. Knee pain in adolescence is very common. And while you probably see one or two causes for knee pain in most of your athletes, don't forget that the list for knee pain in young people is very long. And so if the story isn't acting quite like the other stories, or the recovery isn't going quite as smoothly as you expected, realize there could be something else that's happening. And a good exam, some diagnostic studies, and a treatment plan may be important to make sure that you have the right cause for your athlete's knee pain. The list of diagnostic tests and treatments are extensive, and you can't do them all. So if the pain isn't getting better, consider seeing a healthcare provider that's interested in adolescent sports to make sure you're on the right track. I think this question is key in making sure you're heading the right direction. Was the pain started from a trauma or fall, or was it from overuse or came about slowly? If it was from a trauma, probably better to see a healthcare provider sooner than later. Is the athlete sick or not? Believe it or not, knee pain could be a hint of an illness like an infection. Is the athlete limping? If the athlete limps throughout practice or can't make it through a practice, better to see the healthcare provider now. If the limping is only at the end of practice and not the following day, or not limping at all, probably okay to try a treatment strategy and see if things get better over the next week. Is it constant, or is it off and on? Constant pain likely needs some diagnostic tests and a good exam to find out what's causing it. If the pain is off and on, perhaps seeing if a treatment strategy helps is a good approach. And is it a good time to rest? If it's not traumatic, the athlete's not sick, and not limping in the most important game of the season's tomorrow, perhaps okay to consider playing. If it was from a fall, the athlete's sick, or the athlete's limping, the game's probably not worth it. It risks making the injury worse. Let's talk about a very common reason for young athletes to have knee pain. It's called Osgood Schlatters. It's when the patellar tendon, which connects the patella to the tibial tuberosity, you can't see it on an x-ray, but it would be right here, and it yanks over and over again until finally the relatively weak area, the open apophysis, gets inflamed or painful. Sometimes it even causes a lump and would look something like this. Now, not every athlete gets Osgood Schlatters, but lots of athletes do, especially those that are constantly straightening their knee with running, jumping, or landings. And until the athlete is skeletally mature or this apophysis is closed, they can have pain off and on because of Osgood Schlatters. So if the athlete's still growing, the pain was not from a trauma, they're limping maybe at the end of practice, but not throughout practice. They have good days and bad days, and maybe even switches off from right knee to left knee. And they point to the correct spot, the tibial tuberosity, right where that apophysis is still open, especially when they're doing an activity that straightens the leg, like running or landings or jumping. The diagnosis could be Osgood Schlatter. Where did the name come from? Well, it was Dr. Osgood and Dr. Schlatter many years ago. But we're still dealing with the problem in athletes today. Well, let's look at an MRI and talk a little bit more about Osgood Schlatters. Osgood Schlatters is an apophysitis, or an inflammation of the open growth area of the tibial tuberosity. The itis is the inflammation, the apophysis is the landmark. The blue line is showing you the patellar tendon. It connects the patella to that tibial tuberosity. And the green line is the quadriceps muscle. Now the quadriceps muscle, when it's fired, contracts, and it allows the patellar tendon to straighten the tibia, or straighten your leg. The yellow arrow is showing you that action. The red star is where the pain is, right at the tibial tuberosity. To get rid of the inflammation and pain, we'll talk about the treatment. But what we don't want to do is miss something that could be more dangerous and not want to delay seeing a healthcare provider. We're going to talk about that also. Now, the red arrow at the sunburst is the tibial tuberosity, one of the apophyses. The red arrow at an angle is another apophysis at the kneecap. And if you have pain there, it's called Sinding-Larsen-Johansson syndrome. Pretty much the same problem, just in a slightly different area. It's above the patellar tendon, whereas Osgood Schlatters is below the patellar tendon. Let's look at a few x-rays. These are important not because you're going to get x-rays at practice, but because I want you to know that there are some things that act like Osgood Schlatters and maybe worse. All of them hurt in a similar spot, and usually there's limping, but two of them are surgical, whereas one of them is simple Osgood Schlatters. Notice the blue arrow, it's pointing to the open apophysis, and there's even an ossicle or a small fleck of bone just off to the left. While this may look serious, it actually can be watched, and with a good exam and good monitoring, continue in sport. This shows the tibial tuberosity that's been avulsed or removed from its normal spot. The patellar tendon yanked so hard that it moved it out of the location it's supposed to be. This is surgical. And this shows the growth plate moving forward, and it's a displaced Salter-Harris 1 fracture. If you look closely, this growth plate right here has been pushed off of where it's supposed to be. This is also surgical. We probably won't miss those because there's usually a lot of pain, non-weight bearing, swelling. It's different than Osgood Schlatters that may have minor swelling or possibly a limp at the end of practice. And it's important that we don't try to keep kids in sport or try not to get healthcare when it's absolutely needed. And in two of those cases, it's absolutely needed. Thankfully, avulsion fractures and growth plate fractures are relatively uncommon. And what we want to know is how to treat Osgood Schlatters and see if things get better. Well, one of the most important starts is modified activity. Taking away skills that cause pain for about a week, letting things settle down, and then progress back to those skills and see if the pain comes back. A Dixie cup ice massage can be used at the end of practice, filling water up in a Dixie cup, taking the top of the Dixie cup off once it's frozen, and massaging the area that's swollen can help with pain and inflammation. A strap above the tibial tuberosity can add a fulcrum to the patellar tendon and take off some pressure from the tibial tuberosity. It's not 100%, but it may help. I use a pre-wrap strap where you wrap the pre-wrap around your knee 6 times and roll it up into a band. The band should be above the tibial tuberosity, shown with the blue arrow, and below the kneecap. And then quadriceps can help. Quadricep stretching can help as well, and it should be done before and after practice. Well, that was a lot of information about Osgood Schlatters. And if you're not sure, an x-ray and a good exam can certainly help make the diagnosis. But sometimes, especially if there's not limping, it wasn't from a trauma, the pain is at the tibial tuberosity, and it comes and goes, maybe even switching from the right to the left side. It's certainly reasonable to wait a week or so and see if the pain can be altered with modified activity, a Dixie cup ice massage, a patellar tendon strap, and some quadricep stretching. I hope this was helpful. Be well.